welcome to my channel again. This is Dr. Bess with All Things Nursing. Today I'm going to talk about telepsychiatry, what it is, what it entails, what it involves, the benefits, and all of that. Okay, so first of all, what is telepsychiatry? Before I go into that, I'm going to define telemedicine. Okay, what is telemedicine? Telemedicine is a process by which healthcare services are provided from a distance by means of technology such as video conferencing, right? And telepsychiatry happens to be a subset of telemedicine, right? What kind of services are provided via telepsychiatry? During a telepsychiatric session, services provided include things like psychiatric evaluations, medication management, psychotherapy, to include individual psychotherapy, group psychotherapy, family psychotherapy, and even couples therapy, right? So these are all things that can be provided during a video conferencing session via telepsychiatry, right? And then now you ask me, what does it take? What do you need before you provide telepsychiatric services? First of all, you need to get a job, right? You have to have a job that entails providing telepsychiatric services. And then number two, you have to be licensed. You have to be licensed in the state in which you will be seeing patients, like where the patients are placed. That's what licenses you need to get. So if you're a psychiatric nurse practitioner, a psychiatrist, you need to obtain a license in the state in which your patients are located. Those are the requirements. And then you have to also be credentialed with insurance companies if you are going to be billing insurances for this visit. And in the case of self-pay, you don't need to be credentialed with insurance companies. But then again, most insurance plans do cover telepsychiatric visits, so you need to get credentialed, right? And then another thing that is also important before you can successfully provide services via telepsychiatry, you need Wi-Fi or internet services, because these things take place online, meaning the patient can be anywhere and you are in your home or in your office. So you need to have a reliable Wi-Fi or internet service. You also need to have a tablet, a computer, a desktop, a laptop, or an iPad. So whatever works for you, just somewhere where these sessions can take place, where a desktop, a computer, a laptop, again, like I mentioned, an iPad, equipped with a camera. You need a camera system to be able to see the patient and the patient to be able to see you. Wherever the patient is, the patient can use their cell phone, or if they are going to a clinic to get these services, that clinic has to have a laptop, a desktop, a tablet, an iPad, whatever, so that the patient and you can engage in this safe place where the session is conducted. Also, this for telepsychiatry to be successful, these mediums have to be HIPAA compliant. HIPAA is very, very important. So this whatever you use has to be HIPAA compliant. Okay, and you also have to come in with confidence, because seeing patients via this kind of medium, you have to be able to conduct interviews in real time. It's like the patient is right there with you, but they are far away. So you have to be able to communicate via and feel comfortable using these kinds of mediums to provide healthcare or psychiatric services in the case of telepsychiatry, right? Now you ask me, Dr. Bess, what are the benefits of telepsychiatry? Trust me, there are benefits both for the clinician and for the patient, right? Let's begin by addressing the benefits that are for the patient. Number one, we have a lot of rural areas that do not have psychiatrists or psychiatric nurse practitioners. So these patients sometimes are forced to wait longer than they should before they get in to see a clinician. And sometimes they have to drive miles and hours away in order to be seen. So what does telepsychiatry do for these patients? Number one, it provides access to mental health services in real time, right? thus decreasing the wait times that the patients otherwise have to wait to be seen. Number two, it reduces the need to go to the ER. It reduces ER visits for psychiatric emergencies, because when you can see these patients that do not only have access, but then by you seeing them, they have access. Sometimes they don't utilize the ER for things that could have been handled in a clinic setting. So it reduces the need to go to the ER to be seen, and it also improves continuity of care and follow-up, right? Because when you see patients via telepsychiatry, you not only set a follow-up visit to see these patients again, but I guess they have access to care. If it's like to psychotherapy, you provide it. If it's medication, you can e-prescribe this to the patient's pharmacy of choice, right? So telepsychiatry also does that, and it also does another thing for the patients. The benefits, again, like I said, are enormous, and it also, sometimes people don't have a hard time going to see a clinician, but then if they have access to telepsychiatry, it reduces the need for them to even try to amend their schedule, right? Because you could be in your home, in your office, and get these visits done, right? For those that have issues with childcare, it reduces the need to be looking for a babysitter or somebody so you can go to the doctor, because you can be seen in the comfort of your own home while you hold your child and you conduct these sessions with your psychiatrist or with your psychiatric nurse practitioner or a family nurse practitioner who is trained in psychiatry and is comfortable providing these services. Okay. Another thing it does is it reduces the barriers of transportation. Most people, do not have access to transportation. Some rely on Medicaid drivers to take them to their appointments, right? But then if they have access to telepsychiatry, they can be seen in their home, and the barrier of I don't have a car to drive to my appointment is taken away. Another thing it does again is that it reduces the stigma. Mental health has such stigmatization, but then if you see somebody in the comfort of their own home or in their office, they don't necessarily have to drive and wait in a waiting room where somebody could see them, or where people are ashamed and then people feel uncomfortable being seen seeking psychiatric services. Telepsychiatry takes this stigma away to where patients can be seen, where they feel comfortable, where they don't feel like they're going to be judged and all of that. All right. Now you ask, what are the benefits for the clinician who is providing these services? As somebody that provides telepsychiatric services, I'm going to tell you the biggest one for me is that I don't have to wake up, get dressed up, and enter a car to drive to work. Yes, you can be in your house, in your own comfort zone, and see these patients, right? Without having to drive, without having to wake up, shower, dress up, getting ready. Yes, you have to look clean and professional, but then it's in your own home. Some people tell me they do it in pajamas and you just throw on something. So the psychiatry takes away the drive for the clinician as well, right? And number two, again, like I said, you are in the comfort of your own home, right? Again, like I said, there is a shortage of psychiatric providers for the clinician. Sometimes you are sick and you don't want to drive to work, you call in sick, right? But then if you are doing these things over video conferencing, you don't have to call in sick, meaning patients don't have to be rescheduled. So you can see them while you are sick, but then you are in the comfort of your home. You don't have to worry about going to work and getting other people sick, right? So that's what telepsychiatry does, right? There are several mediums where telepsychiatry can be delivered. Again, I said these mediums have to be HIPAA compliant. You have one, Zoom. Zoom is HIPAA compliant. I use it right now in delivering telepsychiatric services in over 4 or 5 states. So, and you have another one, Doxime. Doxime is pretty affordable and is HIPAA compliant as well. You have Skype Business. I've used it 3 years ago when I was delivering telepsychiatric visits in the state of Washington. So, and you have another one, it's called VSEE, VSEE. VSEE is another one. It used to be free. I'm not sure if they do charge a fee right now, but then these are all mediums, and there are other ones, but the ones I'm familiar with are Zoom, Doxime, VC, and Skype Business, right? And so again, like I said, for you to provide telepsychiatric services, you need a job. You need to have a job You need to be licensed in the state in which you'll be seeing patients, not necessarily in the state that you are living, but the state where your patients are placed. You have to be licensed there. You need reliable Wi-Fi. You need a reliable computer, an iPad, a desktop, a tablet, and then you need to be able to communicate and feel comfortable doing this on this medium, right? When you provide telepsychiatric services, you don't work alone. You work with the staff on the receiving end. Sometimes if patients are at home, the patient receive a link when the appointment is due, and all they do is click and they enter your visit room, and then you guys conduct this visit. But then if you are seeing patients in an outpatient clinic setting or an inpatient setting, the staff there help you complete this visit. You call in, they bring the patients in, you talk to the patient. Once you are through, you alert the staff, and then they bring in the next patient, and so on and so forth, right? So what I advise is for you to try to do a test call first before you engage in such practice, to make sure that everything is set properly and that the patients can hear you, you can hear them, so that if there are any kinks, this can be addressed before you actually start seeing patients live. Again, in this video, we've addressed what telepsychiatry is, who can provide telepsychiatric visits, the benefits for both the patient and the clinician, right? And then the equipment that are needed for telepsychiatric visits to be completed. If you haven't already subscribed to my channel, please do so, and follow me on social media, on Facebook, on LinkedIn, on Instagram. I'm going to leave the links down below. If you have any questions, please feel free to comment and ask them so that I can address them. If there's any topic you would like to see me address, please feel free to do so, and I'll get to them. Again, this is Dr. Bess. This is my first video for the new year, and thanks for sticking around with me. All of those that have already subscribed, I value you. Please, thank you again. Keep turning in to watch my videos, and if you have any suggestions on how I can improve this vlog, please feel free to leave me a comment down below. I read all your comments, and again, this is Dr. Bess from All Things Nursing. I'll see you in the next video. Bye bye.